Just to welcome everyone, today's webinar is hosted by the DBHR through the Washington State Healthcare Authority. This is going to be very interactive, and I'll be asking some questions throughout and really encourage you to participate for the next hour. The slides and the link to the recording will be sent out by email after the presentation. I do want to make a mention that I'll be pausing the recording when we're doing some of the more interactive breakout session type activities. So the recording will really just be most of the information that I'm providing, and the interactions between everyone. The discussion will be paused. I'll pause the recording during that. So welcome everyone. I'm seeing everyone using the chat, which is a great idea. Today is our first of 6 learning community calls for motivational interviewing. And today we're focusing mostly on looking at the spirit of MI, looking at the elements that make up the spirit. Many of you attended our previous 4 webinar workshop or series on motivational interviewing. So this will have a brief review, but hopefully much of the information will be somewhat recognizable to you, and information that you've seen before. Today and the next 5 sessions, we really want to focus on implementing some of the skills that you learned in the MI trainings that Ken Kinter and I did starting in November, and we had those through December. Maybe I can see a show of hands or any sort of reaction on your slides, thumbs up or anything to just let me know how many people attended the sessions on motivational interviewing that Ken Kinter and I conducted back in November, back in December. Just like maybe just a quick thumbs up on your slot, on your little. Okay, it looks like some people are just even type in the chat. Yes, you attended those Okay, good. So I'm seeing some hands up, thumbs ups. Just kind of helps me get a sense of how much to review the information on the spirit of MI. Great. So again, let me get this. My coworker, Ken Kinter, and I previously conducted a 4-part series on motivational interviewing. My name is Joni Dolce. I'm with the Department of Psychiatric Rehabilitation and Counseling Professions with Rutgers University. And I was part of a mental health technology transfer center funded through SAMHSA, and we created materials related to motivational interviewing, and certainly used information from the Miller and Rolnick text from 2013 to include in the presentation. So maybe we'll do a quick kind of introduction. Many people are introducing themselves in the chat. If you want to quickly write in the chat your name, agency, your job role, we may not be able to to introduce everyone. We have over 80 people on the call here, but it will help Ken and I when we get this information back from the chat, just to get a sense of where people are coming from. And then if you can unmute your mic or write in the chat, really what brought you to the learning community today? What was it about today's topic that drew you in? What brought you to today's learning community? This is great. So even if we're not able to formally address every person's name here in the chat, this will be helpful for Ken and I to have this information. Work on your MI skills. Great. MI is something I need to continue to practice. Thank you, Sabrina. So having a place to practice MI. So yes, please use the chat to identify what drew you to today's topic. Let's see. Welcome. We teach MI To professionals who work in vocational rehabilitation, really want to hone my skills, thank you. First time learning about MI, I'm the FSS coordinator, wanting to learn more about MI and practice it. I'm new to my position. I want to learn everything I can to better connect with the youth we interact with. Thank you. Another tool in the toolbox. Wonderful. Thank you so much. So it sounds like many people wanted to attend to really identify opportunities to practice MI and talk with others to really hone that skill. So my colleague, Amy Banco from Rutgers, kind of created some of these guidelines for learning communities. And we really want to reinforce kind of the distinction between a webinar where I'm just presenting information and maybe you're interacting a little bit to what the community, what the learning community is really all about. We really want this to be a place where knowledge is shared, a safe place to really talk with one another, get feedback from peers, talk about some obstacles that you might be encountering in implementing motivational interviewing into your practice and your services. We really believe in co-learning. Everyone here has different experiences and expertise, and learning from one another is part of the learning community platform. Certainly maintaining respect for all of the complex and beautiful identities that we all hold, be present and engaged during the learning community. So really kind of use the opportunity here to talk through problems that you might be having with implementing motivational interviewing. The community is stigma-free, and we really want to facilitate this space for everyone to share, learn, and ask questions. And more importantly, we want to maintain confidentiality. We want to make sure we're never using anyone's name or other identifying information when we're maybe talking about how we're implementing some of the MI strategies. So we want to really be mindful of any sort of confidentiality concerns, and any information that we're sharing needs to be totally de-identified. We're meeting on the fourth Tuesday of every month from 9 to 10 a.m. Pacific time. So we are, I have a list of what the remaining topics will look like. Today, we're focusing mostly on the spirit of motivational interviewing. And just to kind of give a brief background of what a learning community is designed for, again, kind of distinct from a webinar, other more didactic training. It's really a group of learners, providers of services with the goal to collaborate and connect with one another, sharing learning goals, identifying practical ways to apply information that you might have previously learned, sharing information and resources with one another. So using the chat or unmuting your mics. Sometimes it's best in large calls like this. I want to remind everyone to keep your cameras off if possible. The boardroom people, that's not a concern, but sometimes the bandwidth or the Wi-Fi is a little slow. So if that, until you're ready to kind of talk or present, if you could keep those off. So it is a group of people with shared goals, right? So we're all kind of in this shared space to learn more about motivational interviewing. Collaborative. We want to be a source of inspiration for one another, and certainly a network of providers. So our upcoming learning community dates are February. Ken Kinter will be here on February. He was unable to attend today. He apologizes, didn't want to miss it, but it was unavoidable. February is really looking at assisting individuals to focus on their change goals. So we're going to spend some time doing a quick review of helping someone in their, the focusing piece of it. In March, reinforcing and recognizing change talk. April and May, we're going to spend the time practicing OARs, open-ended questions, affirmations, reflections, and summaries. And then in June, we're going to move into looking at stages of change and the continuum of change and how to recognize where on the continuum of change someone might be. So let's get started with maybe getting from you, since this is our first learning community in motivational interviewing, what are your goals for the learning community? I kind of explained what we're going to do, what the learning community is all about, what the overall general goals of a learning community are. What are your specific goals? Ken and I want to make sure that we are meeting your goals, that we are creating this space over the next 6 months to really attend to and meet the goals that you want out of the learning community. So you could use the chat or unmute your mic. So some of what drew you here, some of those statements, could be some of the goals as well, hoping to learn more and implement it with my clients, looking to grow in my development of using it as well, learning how to ask questions to get the person to bring out the answer instead of trying to guide with my own ideas. Absolutely. So really trying to look at the person as the expert in their own change. Better my communication skills to better serve and engage with clients. I'm here to learn. I have a hard time using this, and I'm not always and if I'm not always reminded of the process, absolutely. My goals are to become more effective in explaining MI and teaching the building blocks to others and remembering all of the pieces of MI, asking good questions, new to the position, learning how to further motivate the clients I work with to keep them moving forward. Great, excellent, thank you. So again, Ken and I will look through the chat, so you can continue to type in what your goals are over the next few seconds while we move on into a quick review. So I wanted to just give a quick review of the spirit of MI, and we're really, again, just going to have a very quick review so that we can get into more of the applied and discussion around implementation. But the spirit of MI is really what providers sort of embody when they are using the specific skills. So using open-ended questions, affirmations, reflections, and summaries are all important, but the spirit of MI is really equally as important to being a successful MI practitioner. And it's just as important to identify how to embody the spirit, how to convey the spirit in your work, as it is to learn some of those skills. So the 4 elements that we reviewed back in November, I'll just give a quick review of what they are. Just to reinforce, Miller and Rolnick, the developers of motivational interviewing, have said that practicing the techniques without manifesting and conveying the spirit of MI is like knowing the words of a song, but not the music. Something essential is missing. It also doesn't work. The presence of the spirit of MI is related to positive treatment outcomes. And it consists of or encompasses these 4 elements: partnership, acceptance, compassion, and evocation. So when we think about partnership, we really want to it's really about understanding that motivational interviewing is done with a person, not for someone. The person making the change is the expert, and your role as provider is really to partner with them to support them in their change. MI uses a collaborative approach, and power is shared. And the practitioner works really hard to diminish that power differential that sometimes happens between a person making the change or an individual you're providing services with, and the practitioner, so that neither of them, the practitioner or the person making the change, looks solely at the practitioner as the expert. The practitioner values the person's own expertise, and you want to avoid that expert trap. So we really want to partner with the person and really be able to understand what their own experiences are so that we can help them along their journey. And then acceptance is the second element of motivational interviewing, or the spirit of MI. You may be familiar with the concept of unconditional positive regard. Acceptance in motivational interviewing conveys a similar idea. We accept someone as they are and where they are. Acceptance shows that we have respect for the person's freedom of choice. Acceptance is comprised of four aspects: absolute worth, so believing the person making the change has inherent worth, they deserve respect, and that they should be treated with dignity. Empathy, the provider seeks to understand the person and their point of view and their experience and their emotions, and including any deeper meaning that the person may not be explicitly stating. Autonomy is part of acceptance, where we respect that the person making the change, the individual that you're working with, is in control of the change and the change process. The practitioner encourages the person to be responsible for making the change and recognizes that the change may not occur in the way or on the same schedule that the practitioner would like. In fact, it may not happen at all, but autonomy means that the practitioner accepts and respects the person's decision. And then finally, part of acceptance is affirmation, recognizing and highlighting the person's strengths and all the positive characteristics that the person has, particularly the things that relate to and support the change that they're making. So many of you are working in housing and employment, so those changes will likely be related to going back to work, going back to school, identifying a place to live, and so on, and also other social skills as well. So when we get into May and June, when we talk about OARs, the techniques, we're going to be talking specifically about affirmations, and you'll learn how to apply using affirmations in your work. And then we get to compassion. So the third component or element of motivate, or the spirit of MI. And according to Miller and Rolnick, the developers, compassion is a deliberate commitment to pursue the welfare and best interest of the other person. Compassion in MI relates to the needs of the person making the change being first and foremost. Practitioners seek to understand the person's values and experiences without judgment of the person's thoughts, behaviors, or actions. We do this even if these may conflict with our own ideas about the change and what we think might be best for the person. Compassion includes seeking to understand the person's who's making the change, their point of view, which allows us to really suspend judgment and instead recognize the experience and their values and motivation of the other person. And then finally, evocation is the fourth component or element of the spirit of MI, and it's when the practitioner elicits from the person making a change the reasons for the change, ideas about how the change will happen. It conveys to the person that you know that they have the resources and the motivation within themselves to successfully make the change. The practitioner listens with curiosity and patience and does not offer their own ideas or opinions. The reasons and the process for change will come from the person making the change. Also, people are more likely to change if they come up with those reasons themselves. And when we again get into the ors, open-ended questions help evoke that person's reasons for change. So that was a quick review of the 4 elements that comprise of the spirit of MI. And to kind of tie it all together, I thought we could spend a few minutes here as a larger group, taking a moment to think about how we're already embodying the spirit of MI in our work, and how can we grow more fully to convey the spirit. So think about the following questions, and you can use the chat or unmute your mic. Which elements of the MI spirit best fits with how you currently work? So think about acceptance, partnership, compassion, evocation. Which of the 4 elements best fits with your current work, with how you're currently working? What do you feel like you're already doing well, or feel comfortable doing, or confident, kind of fitting into what you're currently doing? Looks like we have a couple here in the compassion. Someone said compassion, evocation, partnership. And maybe I can ask someone to elaborate. Michelle Toy had said partnership. Would you be able to elaborate on that? What does that look like? Tina Arkenberg mentioned acceptance. If you're comfortable turning on, turning on your mic, unmuting, and talking about what that means, or how that best fits. Or you could use the chat. Okay, Michelle, partnership means that I am not the expert in the conversation. Absolutely. Being a good patient listener. Yes. Empathy, Mark. So I think you're one of the few who mentioned empathy. Mark Bacchus. Can you elaborate on that? What does that mean?
Actually, it's the ability to understand and share the feelings of others, something like that.
Yes, yes, thank you. And which elements might pose some challenges to how you currently work? Which of the 4, partnership, acceptance, compassion, or evocation, might pose some challenges with how you currently work? Remembering that I don't have to solve the issue or problem. I don't have to own the problems or the outcome. Yes, Michelle, that's a great follow-up to what you had mentioned. Evocation is something that people are identifying of potential, an element that might be somewhat challenging. Annie, partnership. The client has their right to self-determination. Meeting folks where they are at could help the case manager and client inspire solutions that come from the client. Yes. Elisa, it's not my job to come up with all the solutions, but rather just be a support system. Yes, that's embodying the spirit. And why might you be interested in bringing all of the MI spirit elements to your work? Why might that be useful, or why might it be helpful in the work that you do? Why might you be interested in bringing partnership, acceptance, compassion, and evocation into your work? It can be hard for people to be helpers, to take on too much and start to own the problem. Doing this can be counterproductive and doesn't respect the client's autonomy and self-efficacy. Having a balance power with not power over. Yes, I think it's really helpful for my clients who are in the earlier stage of change to help them find their motivation for doing the hard work of therapy. Absolutely.
And
So,
Jody, I
yes,
think
Matthew.
I can speak to it a little bit, at least for me. So myself and some of my coworkers from Spokane Juvenile Court are on here, and at least for me, I think the evocation comes a little more naturally because we have
Mhm.
court-ordered conditions and changes that the youth are being asked or even required to make. So I think the acceptance piece in all of this, at least for the work that I do, can be a little bit of a challenge because I'm walking this tightrope of, hey, I want to accept you just as you are, but we're not talking about maybe changing behaviors. We're talking about a need for you to change behaviors so you don't stay in the system.
Yes.
So that's a challenge for me sometimes.
Yes, absolutely. And it looks like that was something that others had mentioned, that acceptance, knowing that, in your situation, Matthew, that the individuals that you're working with do need to make some changes in order for them to stay in the community, right? And continue to work on their recovery. Great, thank you. It looks like people are writing here in the chat to provide a more well-rounded service that my clients can rely on to provide intentional support, utilizing an evidence-based approach. Yes, I also find the balance of power difficult for myself, especially when working with youth. Yes, Maddie, I think that that's a very common challenge, and individuals, just like Matthew kind of mentioned, when you're working with youth, sometimes that could be very difficult. And then one more. I'm working with clients who are living with a psychiatric diagnosis. The element I think is most important is acceptance, but the one we usually struggle with could be evocation. Partnership is important as well because we engage in clients' everyday lives. Great, thank you. So I thought we would spend our remaining time after that brief review really talking about some successes and challenges and getting some support from the group, um, and kind of having some really uh, in-depth discussions in a breakout session, about what some of those challenges and successes are in relationship to today, the spirit of MI. So in relationship to those four elements that we just talked about, to get some feedback from others, come back together as a larger group to really kind of look through and kind of use this time to really think about how are we incorporating the spirit of motivational interviewing into services? How are we? And starting with looking at a success. What is the success? And we're going to have some breakout rooms in just a bit, and I'll flash this slide to the breakout room, but I'll give a little bit of an instruction. So we're going to spend some time. We're going to spend about 10 minutes in the breakout session, um, talking through what was a success over the last, I said 2 months, just because that's when our training started, and that's when we reviewed the spirit of MI in our original training. What's been one success or two? It doesn't have to just be one over the past couple of months related to incorporating the spirit of MI, using kind of embodying the partnership, acceptance, compassion, and evocation. What's been working well, and what contributed to the success? What do you think contributed to you feeling that you've been successfully able to embody that spirit of MI, that element? Um, Maybe there's a certain element that was easier than others, kind of based on our previous activity. And how have your interactions changed with individuals that you're working with? Has there been a change? What kinds of changes have you seen? What are some of the outcomes? What are some ways that really intentionally incorporating the elements of the spirit of MI, what's happened since then? Um, and then what are you doing to sustain that success or sustain incorporating the spirit of MI? What are you doing to keep it going, and making sure that, because many of you wrote in the chat, sometimes I forget to use it, sometimes just having a refresher is nice. What can you do, or what are you doing to sustain that spirit of MI in your services? So let's see. Let me just see, there's one more. Um, Someone just mentioned, I just finished my training as a health coach, and we'll be starting to work with a patient this week. So I'm new to MI and hopefully see
They do
myself
what?
grow. Yes. So please make sure to mute your mics. And
Uh-huh.
I'm going to,
And for what? The beer
Kim,
thing?
I think, let me see. Okay. So I'm going to open up the rooms and we'll have a discussion, come back to the larger group and we'll talk about these responses. So you can identify one person to kind of facilitate the group and, you know, ask the questions, and you can each have a turn if we have enough time, but it's currently about 12:30, so maybe about 12:40 we'll come back together as a larger group and talk about some of your responses. So I'm gonna pause the recording and create the breakout rooms now. So please, when you receive the invitation for your breakout session, please make your way into the room. I'll try to come into as many rooms as I can. We have quite a few people, so wait another few minutes. People are joining. Welcome back, everyone.
Oh.
So just as a reminder, when you come on back, you'll have to mute your mics again. So do we want to hear from a couple of rooms about their success, what went well, what contributed to the success, what was the specific spirit or combination of the elements of the spirit of MI that really helped? One, two, three. Who would like to further discuss?
I'll talk about kind of our room there.
Great, thank you, Jennifer.
So we talked about how we can use the motivational interviewing to provide support that the permanent supportive housing, we have an opportunity to use that motivational interviewing every day to support our residents, to build them up, to dig deeper to find out what their goals are, where they want to be, and then how to help them get to those goals. Sorry, I forgot.
So, what's been someone in your group's a success with incorporating the elements of motivational or the spirit of MI? Was there anything that someone mentioned that contributed to the success of incorporating acceptance, compassion, evocation, and partnership? And how have interactions changed with individuals that you're working with now that you're intentionally using or incorporating those spirit of MI elements?
So the success story was using the motivational interviewing techniques to help a veteran who showed up here who wasn't actually qualified to be in my place, but I was able to use that motivational interviewing to dig deeper to find out where she wanted to be, what things look like for her, to build her confidence by pointing out the strengths that she had showed, that by showing up, by following through, by taking the steps she needed to move forward on her own. The biggest thing was that she felt supported and she felt motivated. She had once we had dug deeper, I was able to give her targeted resources where she was able to go out then and have a maybe more successful attempt at finding housing on her own.
Great, thank you. So others would like to share kind of a success in incorporating the spirit of MI. Thank you so much, Jennifer, and your group. What contributed to the success? How have your interactions changed with individuals you're working with? Would love to hear from another group.
I can share on our group.
Thank you, David.
I heard a lot of partnership in our group,
Okay.
compassion, um, building trust with individuals,
Mm-hmm.
not being someone who knows better, but is there
Yeah.
with you, walking side by side. I think the main thing I heard was we're there with you, and we're building trust and walking side by side with you. And the transformation and just knowing that, hey, someone's here with me, walking with me, not trying to tell me what to do. Just they're just here. So that's what I heard. That's what I heard in my group.
Great. Thank you, David.
Yep.
And Dara H, has your hand is raised?
Yes, thank you. I think for our group, we talked a little bit about just sometimes the challenge with motivational interviewing, working with maybe juveniles is you don't want to draw too much out, but you want to be able to help, provide that line of questioning so that you can really help guide them in really kind of discovering that they have kind of their own answers. So we kind of had that consensus. And then I think some of the wins and things that I heard in the group was that we are so excited when we use this way to be able to approach the individual, because we can provide them an opportunity to find hope, to find that they have some power. And so by empowering them, providing that hope, that it kind of opens up another avenue. And so then maybe they think, okay, I could do this. What else can I do? And that might lead them to go back to school, to, open up avenues that they hadn't thought of. So I think there was some really great conversation around how this kind of really starts to contribute to the success. I don't think we got to the next question about how the interactions have changed, but I just think the spirit of incorporating that into the services was a very positive, and everyone really wants to be able to, to learn more and grow in this so that they can empower those individuals.
Thank you so much, Dara. And I think you kind of got into the interactions changing a bit, because it sounds like the interactions focused on hope, and maybe they've
Yeah.
always focused on that, but continued to focus on that optimism and those small successes building on each other, and individuals you're working with kind of moving forward. Thank you.
Yeah,
And
thank you.
just finally, did anyone have an opportunity to address that final piece? What are you doing to kind of sustain the keeping the spirit of MI at the forefront of your practice and into your services? What are you doing to make sure that you're continuing to think about those four elements intentionally when you're providing services?
There was a comment in my group. My name's Kaylee, so I'm on a shared
Hello.
account. But there was a comment in my group that one of our group members talked about taking notes and using the participants' change speech in there and documenting that in those notes, and then referring back to it at later meetings. Like, I remember when you said this. How's that going for you? So
Yes.
calling it back to their own intentions, what that looks like for them, and then not necessarily holding them accountable, but inquiring again, what does that look like for you now? So
I
leading,
love it.
yeah, from their own position.
So kind of being mindful of what the person is saying, and that might be asking the person, do you mind if I take some quick notes, so that you can refer back to those notes, so that the person knows that you're listening and hearing, and kind of all relating it all back to that person's change. Great, thank you. So we talked about successes. Let's talk about what's been difficult in specifically incorporating the spirit of MI into your services. But if you haven't had an opportunity to attend some of the previous trainings, and more specifically the training around the spirit of MI, think about motivational interviewing in general. What's been difficult? What's been a challenge in incorporating the spirit of MI or even MI in general. What's helped you to overcome the challenge? And then looking back, what may have been helpful, and what are some suggestions to others in the group who may be experiencing a similar challenge? So I think for time purposes, maybe what we'll do is just kind of share this in the larger group and kind of use the large group here to think about those challenges. What's been difficult in embodying, incorporating the spirit of MI or incorporating MI in general into your services?
I guess for me, it would be uh, early on, I guess, was, it was hard to do active listening. Not hard, but it was because I had so much I wanted to share. So kind of not oversharing, just being there and listening and just hearing what they had to say. That was kind of a challenge for me. But I'm learning
David, that's
to just be there, just be that space.
yeah, that's difficult. I share a similar challenge with that. Sometimes you know might have suggestions or things that have worked in the past for people who may have similar situations, and but really suspending that advice giving, suspending that urge to talk and just listen is sometimes very difficult. Thank you for your honesty. What's helped you to overcome that challenge?
I guess a lot of so the nonverbals, I see a lot of nonverbals, and so I just kind of learn to just, I don't have to share all the time. It's not about me, it's about what they got to say, and if time's right. So I think I just been paying attention and catching myself too when I'm ready to fix and teach, I guess you want to say. But so yeah, just being aware of that. And
Yeah, so using the nonverbals, the head nodding, eye contact, right? Open stance, all of those nonverbal behaviors that can really kind of help us stay focused and um, in the moment with the person. Thank you. Someone wrote in the chat, the biggest challenge is using MI when the client is decompensating. We can use the same methods, but they aren't as effective. That's something important I'll make a note of for future learning community calls. It sounds like that might be something that we could have a discussion around. And then Michelle wrote, I have a hard time knowing where the client is in the stage of change. Absolutely. So sometimes knowing that poses some difficulties in the skills that we or the way we want to interact.
I think sometimes too, Joni, at least one of the programs I run is called EET. When there's a certain curriculum, there are materials that need to be covered, and there's a short time window. So sometimes I'll have kids, they're on probation, they've only got a little while left on their probation. The curriculum needs to be covered in order for the evidence-based program to fulfill the QA and all that jazz. Quality assurance, then it can be more challenging because I'll see these opportunities for MI, but I'm like, well, we won't get through the materials we need to get through if I go there. So that's a challenge for me sometimes.
Having to kind of have a short time frame that you're working with someone and not feeling like there's the time to really incorporate all of those elements. What's helped you to kind of overcome that challenge? Or what do you think might be helpful?
Yeah, no, that's a great question. I think you know, I think there've been times I've been able to kind of balance dipping into it and knowing that maybe it can't be as open a space as I wish it could be, just because of the nature of the time frame and what they need to get done so that they can get some of the rewards that have been promised to them and complete what they need to complete. So I think it's just been going 50 balancing. Okay, I can't take this where the counselor inside me would like to take this, but we can explore it a little bit.
But it sounds like you can certainly, and you have been, based on your previous comment today, incorporated that acceptance, right? You're incorporating the partnership. You're compassionate to where the person is, and having that compassion and recognizing that, you know, it's for the good of the person. You need to help them get through the curriculum or get through the educate. Yes, so that is compassion for the person. You're kind of suspending some of what you would think would be helpful, right? The using the counseling skills, and I think that's a great example. Thank you, Matthew. And then people are saying, I'm not sure what to do when I believe my idea for their progress is more practical and more realistic than theirs. Any thoughts on that? Someone mentioned in the chat, I'm not sure what to do when I believe my idea for their progress is more practical and realistic than theirs. Has anyone encountered that thought or belief and may provide some suggestions?
I like what somebody shared earlier about just taking note of that and then asking a follow-up question later on and see how that's been working out.
Yeah, that's a great suggestion. Someone wrote in the chat, put yourself in their shoes. You may not be seeing what they are seeing. Yes, so try to understand what their perspective is, and that's certainly a challenge at times. Love that suggestion. And we'll take one more suggestion. Many youth come to having been told that they have to do X, Y, Z and have to interact with me, which makes it for a difficult start. It's good to be able to share that everything is voluntary and I'm here when they want me to be. Many youth haven't heard anyone say that as an adult isn't here to say that an adult isn't here to direct them, but rather to uplift them. Yes, I love that suggestion. So Maddie, that's great. Just, you know, right from the beginning, let them know that you're there to partner. You're there to help guide them. You're not there to make the decisions. And when we get into some of the techniques, the open-ended questions, affirmations, reflections, and summaries, those will help illustrate that message as well. So we are at the hour. A quick preparation for our next session. So our next February learning community will talk about assisting individuals to focus on their change goals. So before we go, and I'll send these out, identify an obstacle that you encountered related to helping an individual focus on their change goal. So without using any identifying information or anything that could violate HIPAA, what was the person's change goal? So what was the goal? What got in the way? What motivational interviewing skills were you able to use? And what motivational interviewing skills were difficult to use? So we'll have a discussion about that next session. So it is just about 10 o'clock. So I will see everyone in February, or certainly Ken Kinter will be here in February. And then our plan is to be here partnering ongoing. So thank you, everyone. And if you have any questions, I will put my name in the chat and my email. If you wanted to reach out, please feel free. So thank you so much. And look for an evaluation along with the PowerPoint presentation. We're kind of at the clock, and I want you to still be able to evaluate, but I want to be respectful of your time today.
Thank you, Joni.
Thank you. So here is the survey if anyone has an opportunity to complete it. Appreciate it.